So scleroderma is an autoimmune condition where the body starts to harden, and the skin can harden, the tissues can harden, the organs can harden. And so it's very, very important as a practitioner to not only be managing the typical immune pathways and inflammatory pathways, but really, really trying to aggressively treat that hardening, because that's often what's going to create the symptoms, that's what's going to create the problems for people long term. Your liver can't function if it's hard. Your heart can't function if it's hard. So we need to keep those tissues moving and supple and doing what they're supposed to be doing. The scleroderma is a little broader than sort of a single tissue. One of the features that's common among all of my scleroderma patients is that their hands get very, very, very stiff. And so one of the tests that I will do with them in the office is just having them make a fist. And how large is the gap between their fingers and their thumb? And we can use that as a marker for the suppleness of their tissues in their hands. Part of the big challenge with some of these autoimmune conditions like scleroderma, like lupus, like dermatomyositis, is that there is no internal sign, there is no internal symptom for hardening of these tissues. We see on labs that their labs start to alter, that the function of these organs goes down, but oftentimes it really doesn't come with very many specific symptoms. They're a collection of vague symptoms. So, their heart is not pumping efficiently, their liver is not removing wastes effectively, their kidneys are not filtering properly. And so it's a little bit sneaky, because if you don't know to look for the problem, it often goes unchecked, and then people are diagnosed quite late.